Okay, so hello everyone. Welcome to our first Cafe Connections. Just a quick reminder, this will be recorded. And we are so excited to come together this afternoon to discuss two very hot topics, nutrition and stress management. My name is Carly Keller and I'm a UC patient. I was diagnosed when I was 14 years old and I'm 17 now. It was a really long and hard journey for me personally. It was really hard for me to get my symptoms and everything under control. But thankfully, as of 2016, I'm in remission. Or yes, I think no, 2018, I'm in remission. So that's been really great, and I'm very blessed, and I'm doing very good, and I love working with the foundation and also being a member of the junior board. I also have the pleasure of being the Charlotte Take Steps honored hero, and my family and I have participated in Take Steps for the past 4 years, and Take Steps is one of my top ways to fund the various research projects that the Crohn's and Colitis Foundation has dedicated to finding a cure. Take Steps is so important to me and my family, and it has become a big part of our lives and our family friends' lives as we all get involved with going to the walks or with different events that they hold. And it's been a really great community thing for my community in my small town of Harrisburg. And I love Take Steps so much. And the foundation is currently supporting several studies investigating factors believed to play a role in IBD, such as diet and psychological stress. For example, the DINE-CD study is a clinical research study sponsored by the Crohn's and Colitis Foundation and the Patient-Centered Outcomes Research Institute to evaluate the effects of nutrition-based intervention on patient outcomes. DINE-CD compares the effects of a Mediterranean diet and a specific carbohydrate diet in reducing symptoms and reducing intestinal inflammation in Crohn's disease patients. Additionally, there is also research focused on understanding the effects of both early life and daily perceived psychological stress on the biological processes underlying IBD and development of flares. These studies aim to identify measurable psychological parameters that can be used in the clinic to predict stress-related disease relapse. The parameters include stress-dependent changes in inflammatory and vascular factors, microbiota diversity, microbial, metabolic byproducts, and central nervous system function via brain imaging. The foundation is continuously working to improve the quality of life for patients with the goal of finding a cure. If you have any questions, please place them in the chat and we'll answer them at the end. So at this time, I would like to introduce our first speaker, Mary McBreedy. I hope I pronounced that right. I'm really sorry if I did not. And Mary is a registered dietitian with 5 years experience in clinical nutrition and a specialty in nutrition support. She is passionate about helping individuals maintain adequate nutrition throughout challenges that may arise during acute and chronic illness, with a particular focus on providing evidence-based education and recommendations for patients with a variety of gastrointestinal conditions. Mary is currently practicing at UNC.
Thank you, Carly. Can you guys hear me okay? Great. Like she said, I'm Mary McBready. I'm a dietitian at UNC Hospital. I work mostly with patients admitted to the hospital, but also with adult clinic patients as well in an outpatient setting. Dietitians have multiple different hats and play many different roles, typically in the healthcare setting. One of the big things that we work with is helping individuals maintain adequate nutrition and prevent malnutrition and vitamin and mineral deficiencies throughout the challenges that might arise with certain illnesses. With IBD, nutrition can certainly be a particular challenge for a variety of reasons, including disease symptoms themselves, the side effects of certain medications and complications of the disease. The bottom line, number one goal is really to obtain a balanced diet as much as feasible and as much as possible. This includes including good protein sources, grains or starches, fruits and vegetables, as well as dairy and milk alternatives. More information on what a healthy, balanced diet entails can be found on myplate.gov. To date, like Carly alluded to, there are no special diets or specific diets for Crohn's or colitis, but there are a lot of really interesting or research studies going on through the Crohn's and Colitis Foundation, including looking into the effects of the specific carb and Mediterranean diet on their ability to resolve symptoms and bowel inflammation. Foods generally tolerated for many people better than others, particularly during flares. Some things that can be difficult to tolerate would include foods that are slower to digest or tend to stay in your digestive system longer. That includes fibrous foods, really high fiber foods, high fat, greasy foods. Carbonated beverages can introduce air into your digestive system, and sometimes that leads to gas or bloating. Again, nutrition is really individualized. Some people tolerate these foods just fine. When in remission, it's actually good to gradually kind of increase your fiber intakes. So it can be really, really individualized. And if you feel that you're having trouble getting adequate amounts of nutrition, or you have questions or concerns about your diet, it would be great to seek help from a registered dietitian or inquire with your physician about getting connected with a dietitian. And that was just kind of my brief introduction. A couple of other things that do tend to go better are consuming 4 to 6 smaller, more frequent meals rather than 3 big meals, and just kind of eating slowly in a relaxed environment. At this point, I'll go ahead and open it up if anybody has any questions they'd like to talk about.
And feel free to either put your questions in the chat box or unmute yourself to ask Mary any questions.
Hey, Mary. My name's Beth. Thanks for being here today. Your audio was coming in and out a little bit for me. Did you say that you treat pediatric patients? It may have been on my end. But
no worries. Yeah, I know sometimes with the Zoom it can be challenging. I work primarily with adult patients. I can answer general questions with pediatric patients, but some more specifics I might have to get back to you on. Yeah.
I was just to ask a little bit about any sort of advice on sort of, growth spurts in adolescence, kind of meeting the nutritional, maybe additional calorie needs at different times. And, if things seem under control, I try to let things kind of go, let her make the decisions and stuff, because things seem to be going well. But sometimes, when people are going through a growth spurt, you see there's periods of time where they're eating more. Just any advice to adolescents with Crohn's, that just general nutritional advice that you would have?
Yeah, and that's a great question. I know adequate growth can certainly be something that's very closely monitored with pediatric patients and adolescents with Crohn's disease. So that is something that continuing to monitor that the growth is appropriate for age. And really, just as long as they're able to follow a good balanced diet and include all of those food groups with at least 3 meals a day, it absolutely is great for them to make their own choices and experiment or make their own decisions when it comes to diet and nutrition. Did that answer the question okay?
Yeah, yeah. You know, I was just thinking of how kids will sometimes just eat loads at one meal and then the next day they're not hungry. Like it's not always the same as adults when they're sort of growing. And so, you know, I'm just trying to sort of just roll with it and not say anything as long as there's no symptoms. But just, you know, I don't know if trying to avoid too much of one group, if there's any evidence about that or anything like that. But yeah, that just any general thoughts that you had are great. Thanks.
Yeah, absolutely. I know sometimes it's not always consistent day to day what teens or adults even eat. But yeah, I think the number one priority would be, even on those days where they're eating less, just ensuring that they're, you know, trying to get at least 3 meals a day for the most part. And the more variety in the diet, with the variety of different fruits and vegetables and protein sources and everything, the more nutrients and different vitamins and minerals and fibers that they would get. So that would all contribute to a good balanced diet.
And there are a couple questions in the chat as well, Mary. One being, are there any specific diets that you have seen that are more effective than others?
Yeah, that is a great question. It is challenging because everybody tolerates foods so differently that it really just depends on the individual. One really helpful thing to do is to keep a food journal. So that way you can kind of notice overall trends with what foods you might tolerate best yourself. So even though right now there's no proven diet that I would recommend to the general population of everybody who has Crohn's and colitis, it can be helpful to just keep track, even just temporarily, of what you're eating to see if you notice some trends when you consistently eat a certain food, if you're having symptoms after that. I wouldn't give up on a food if you try it once and you know that you don't tolerate it. But just if you notice consistently over time.
Thank you so much, Mary. Are there any other questions before we move on to our next speaker?
Yes, I put a question in the chat. This is support Brun, Dr. Brun.
Yes, I saw your question. We can definitely send out some more general guidelines after this call. We have a bunch on our foundation website, and I know Mary has some as well that she'd be willing to share. So yes, we can.
It's a lot to absorb within one meeting. So if everyone has like something to hang on to or to read and reach out to her if they have specific question, that would be great. Yeah.
Absolutely. We will definitely send that in the follow-up. Thank you for asking that. That was a great question that I'm sure everybody was thinking.
Great job.
All right. Well, if there are no other questions, we will have Carly introduce our next speaker.
Mary, thank you so much. And our next speaker is Dr. Allie I'm going to butcher Cotillo. Dr. Allie is a pediatric psychologist who works with kids, teens, and young adults with IBD and other GI disorders. She received her PhD in clinical psychology from the University of Alabama at Birmingham, with a specialization in working with patients with medical illnesses. Pediatric psychologists help people with complex medical conditions to manage pain and other symptoms, cope with and adjust to a new diagnosis or treatment change, and developing coping skills to navigate mental health conditions such as anxiety or depression. Dr. Cotillo is currently working in PGI at Levine's Children's.
Thanks, Carly. Yeah, so I'm Dr. Ali Cotillo. I started here at Levine Children's in Peds GI actually in October. Before that, I was working in different divisions of Levine Children's, and I was at different children's hospitals before that. So currently, I'm seeing a lot of IBD patients. I'm actually a UC patient myself, and I work with kids, teens, and young adults. The thing that makes pediatric psychologists a little bit different than more general therapists, counselors, psychologists is that specialization in working with medical conditions. So I work really closely with the GI providers to be sure that we're providing care for the whole patient and implementing coping strategies for whatever challenges come up with navigating an illness. And, something I just want to talk a little bit today about stress management, is that something that all of us, whether or not we are dealing with a chronic illness, it's something that is so important to be talked about right now when we're in the middle of a pandemic and, social, political, racial issues in our society that are coming up, and that especially, if there are either parents on the call or teens, these are difficult conversations that we're having to navigate. And so many aspects of what we're going through right now are unprecedented, and we have not been trained how to handle them. So stress management is so important to talk about. And in the context of having Crohn's or colitis, there is such a strong brain-gut connection that I'm sure a lot of people are aware of or have heard of. But as a psychologist, GI is one of the most research-supported disciplines that psychologists work in. So the interventions that psychologists can provide really can make an impact on that brain-gut connection, because when we're stressed, our GI system is stressed, and we can have increased symptoms, whatever that might be, pain, diarrhea, constipation, and it can even contribute to just setting off comorbid conditions like IBS or other GI disorders, functional abdominal pain that can go along with IBD. So I generally think it's helpful to just review some just general stress management strategies. And so I just created a little bit of a visual guide so you can have a sense of what I'm going to talk about. And I'd be happy to answer any specific questions. I know this audience, I was kind of prepared for it to be a wide age range, parents, patients. So I want to be able to address any specific concerns. And I'm actually thinking I'm going to put my email in the chat if anyone has specific questions. So I work with Atrium Health, so I see kids, teens, and young adults who are followed by GI providers here. So if anyone is an Atrium patient and wants to get a referral, that's also a way that I'm available. So navigating through stress. It's really important. Not every one of these strategies is going to resonate with every single human, and it's important to find out what works for you best. And there are lots of different strategies to decrease stress, decrease your heart rate, decrease the cortisol levels that are going on in your brain and in your body, and to really soothe that brain-gut connection. The first one that I always like to talk about is stay grounded in the present moment. So this is a really good intervention for people who have a hard time either perseverating on things that have happened in the past or things that have not happened yet but could happen in the future. All we have control over is ourselves in the present moment, and sometimes it can be helpful to just stay really grounded. And even as we're talking about this, you can practice this by focusing on your surroundings, focusing on 5 things that you can see, 4 things that you can hear, 3 things you can touch, 2 things you can smell, and 1 thing you can taste. So focusing on the 5 senses to really ground yourself in the present moment. Doesn't matter what order you do those things in, but that tends to be a pretty easy way to do it because you can't really think of 5 things you can taste. And even as we're doing this, everybody can just, if you're noticing yourself, I know for me, I tend to definitely notice that my shoulders come up to my ears when I've been on my computer for a long time or when I've had a really busy day. So if everyone can just focus on just kind of releasing your shoulders, letting your face kind of relax, letting that brow furrow release, and just kind of feel free to take some deep breaths while you listen to me talk about stress management. Deep breathing is something we hear about all the time, and a lot of people will hear when they're really stressed, just take a deep breath, it'll be fine. And a lot of times people come to my office and that has never worked, because it actually is a skill that takes a lot of practice to implement when you actually need it. You think about any other skill that you may have built in the past, any sport you've played or any musical instrument you may have played, you would never show up for a game without having attended practice. So deep breathing is something that can be so helpful. It can regulate your heart rate. It can decrease blood pressure. It can make physical changes in your body that help decrease stress when it's practiced regularly and not during times of increased stress. And when I'm talking about this type of deep breathing, I'm talking about breathing with your diaphragm, which is the muscle that sits like right under your lungs, like here, and breathing into your belly. So picturing like a balloon, you're inhaling, the belly is expanding, exhaling, it contracts again. And so breathing at a rate of something like 6 breaths per minute, so taking a good 10-second breath is a lot longer than most people really think to do it, but it can be really effective. Even just doing that for 1 or 2 minutes a day can be really helpful in decreasing overall stress and in bringing that strategy when you are in periods of increased stress. So you're much more likely to use it if you practice regularly. Feel your feelings with all these cute little emojis. So something that I have noticed in my practice is that a lot of people tend to push away difficult feelings and big feelings that are uncomfortable. And there's actually a saying that I believe was from a psychiatrist or maybe a neuroscientist, I don't quite know, I should check on that, but if you can name it, you can tame it. So feeling your feelings and identifying them can really help to make a plan and cope more effectively. So when we push feelings away and we don't want to feel them and we just try and distract ourselves all of the time, that can actually contribute to increasing stress. So feel your feelings. It's okay. It's okay to be sad. It's okay to be disappointed. People have lost loved ones, but have also lost experiences like graduations and jobs and opportunities and just in-person holiday celebrations. And so it's okay that that's disappointing and upsetting and stressful. And, you know, as I work with a lot of families where the parents have a hard time, where you want to make your kid feel happy and calm all of the time, but sometimes it's okay to feel them and then make a choice about how to cope effectively. Spending time outside is actually another, all of these are research supported interventions. That's how I practice. But spending time outside, even for 15 minutes a day, can have a really positive impact on mood. Some people respond to this and do it more naturally than other people, but sometimes we get, especially with this virtual world of online school and remote work, that we never spend time just outside. We stay in all the time. All of our errands can be done from the computer, and so it's really important to try and remember, if you're having a hard time, to get some fresh air. It's also another way to stay really grounded, is to just connect with nature and focus on your thoughts and feelings in those different environments. A change of scenery can also be really helpful, because when we are really stressed, all of the cues around us can help maintain that stress. So if I'm just sitting here with my computer and my phone and my desk all day stressing, then those things I'm going to start to associate with stress. So changing the environment every now and then can be helpful, just to get a reset. Set boundaries. So some people have a really hard time, especially just it being, there's just so much going on with the news right now. And so setting boundaries with smartphones, with technology, with Twitter, with texting, with difficult conversations can be really helpful for people to figure out what's going to help you cope. Is it really helpful for me to be on Twitter all day long with this anxious need to know everything that's going every second. Does that really positively impact my life and my well-being? Or maybe I can set a limit of 30 minutes of social media per day and see how that goes. I wouldn't recommend going from all day to 30 minutes. Of setting yourself up for failure, but gradually decreasing to kind of set boundaries around our exposure to things that stress us is something totally important to do. Move your body. So it can be really overwhelming. You know, it's January, right? So everyone's like, new year, new me. I'm going to work out 6 days a week and I'm going to eat healthy and completely revamp my whole life and my diet and everything. I'm going to get a planner. But even just moving your body a little bit a day can be much less overwhelming and really helpful for an overall mood boost. Doing yoga, stretching literally and releases endorphins, going for a walk once a day. These are all things that can contribute to overall well-being and can help you move toward healthy lifestyle and stress management goals. Practice gratitude. So this is kind of an interesting one. It's actually a really helpful intervention for things like loneliness or disappointment. So there's been research behind gratitude journaling, and this does not resonate with everybody, but for those that it does, writing down 3 specific things that you feel grateful for each day can really have a positive impact in your overall well-being as well as your outlook, and can just, in general, writing and journaling can be really helpful to just get your thoughts from just this place where they're swirling around in your brain to a much more tangible place. So these are all things that maybe they just remind you of something that has worked in the past. Maybe there's something here that you haven't tried before or that's resonating in a different way. These are all things that can be tried independently. I would try 1 a day and see how it goes. And, you know, it's just the most important thing at the end of the day is to find what works for you. So I just want to talk a little bit about how to know when it's time to ask for help. So I think something really important is trying to maintain social connections during this time when we're not seeing people as much, trying to get creative about virtual ways of communicating. I've worked with some kids and teens who are having most of their social interactions through video games with friends, and it's a hard time. So it's important to ask for help when you need it. And if stress gets to a place, or anxiety or depressed mood or difficulty with motivation is getting to the point where you feel that it's impacting your day-to-day life, your ability to do the work that needs to get done, your ability to do schoolwork, your ability to enjoy the things that you usually enjoy, or your ability to eat or sleep, that's the time when it's time to then look for professional help. So I know there's lots of different ways to go about that. A really nice one is to ask your primary doctor for therapy recommendations. It can be really difficult to access appropriate mental health treatment, but sometimes just calling your insurance company and asking for a list of providers who take your insurance, who are in your area, who work with your age group is a good way to go. And there's a website called Psychology Today that you can sort by insurance and by age, and that can be another way to find a good provider. I would look for somebody who practices cognitive behavioral therapy, which is very skill-based and problem-focused and looks at the relationships between thoughts, feelings, and behaviors. So I always think that's important. We all need to learn day-to-day strategies for stress, but when it gets intense and gets in the way of life, that's when it's time to seek professional help. So I'd be happy to answer any specific questions that people have or elaborate on any of these. So just let me know.
Thank you so much, Allie. We have 2 questions in the chat. The first being, can you touch on the effect of adverse childhood experiences on anxiety and worsening GI symptoms?
Yes, absolutely. So an adverse childhood experience is something that happens in childhood that is very acutely stressful. So examples are abuse, examples are having substance use and abuse in the home, neglect, significant caregiver mental illness. So these are all things that can contribute to increased stress and psychological problems for children. And certainly any instance of increased stress has an impact on the GI system, especially when stress is chronic. It can have just kind of the impact can build over time. So if a child is in a situation where they've had adverse childhood experiences, I think it's important first to know the extent of the trauma and if they have any PTSD symptoms. So there's specific types of providers that can treat kind of trauma-focused intervention, and you would want to be sure that the child is stable and has the coping skills necessary to kind of go about their day-to-day functioning. But yes, certainly ACEs can have a huge impact on long-term anxiety and GI issues.
Thank you. And then the second question we have in the chat is, can you suggest any apps to help reduce anxiety and set boundaries?
Yes, I definitely have apps to help reduce anxiety, and I'll talk about a few, but I can send out a list that I hand out a lot. I don't know about apps to set boundaries. I know if you're talking about specifically with screen time, you can set limits in an iPhone. This is something that's case by case, where I have to kind of work with people and figure out with their specific device how to do it. I don't have a specific recommendation for that, but for anxiety management, I use a lot the Calm app. And the thing I like about the Calm app, it's the one, it has like commercials, so you've probably heard of it. And there are parts of it that are behind a paywall, but I don't use those parts. It has a breathing metronome, which can help time your breathing to an actual therapeutic pace. So I'm going to show you what that looks like. And then a few others are kind of related to guided mindfulness exercises, because I think that it can be really hard to ask somebody to just be mindful or practice meditation on their own. It can take a lot of support to learn those skills. And mindfulness is pretty much just being in the present moment and noticing. That's kind of what mindfulness is. So just noticing your senses and noticing what's around you and being present. And okay, so this is finally loaded. So this is like what the Calm app looks like. It tells you when to breathe in and out. So that's how slow it is. That's like one breath. And it makes noises too. I don't have the volume up, but. And then the guided meditation apps, there's one called My Life. It looks like this. It's for kids and teens. So it's like a little cloud. And then there's one called Smiling Mind. So those are my top three. And there's one for instances of kind of self-harm behaviors, if there's more severe mental health issues or cutting or urges to cut. There's an app called Calm Harm. It's kind of a weird name, but it's very effective.
Thank you for sharing those. And if you send those lists to Paulette and I, we will make sure all the participants on this call get that list as well. We have another question in the chat. Can you speak about risk for ARFID in kids with GI disorders? And if a child experiences food avoidance, are they likely to return later in adolescence or adulthood?
That's a great question. ARFID is, I don't want to give the wrong words in the acronym. It has to do with restricting food, and it's different. There's a difference between ARFID and an eating disorder. So with ARFID, kids can develop aversions to certain types of food and will avoid eating them usually because of an adverse experience. So they had a negative experience with a specific type of food and they will avoid it. And sometimes it can then be generalized to other types of food and it can get in the way of progress with nutrition. I honestly would need to look up, and I'd be happy to get back to you. I do not know the trajectory of ARFID, like if they're likely to return later, but with most kind of issues with mental health or behavior, that with increased stress and transitions, issues can come back up. And the most important thing is to have coping skills that you can fall back on. it's definitely a problem that I see for kids with GI disorders, because a lot of times food triggers, or trying to figure out what allergies or what foods are causing Crohn's or colitis symptoms can be kind of what leads to a diagnosis. And so that can really create some serious aversions. And the therapies that I tend to use are using relaxation strategies and exposures, and kind of setting small incremental goals, very individualized for each patient. So it's definitely something I see a lot. Yeah, just to summarize, it's something that can happen with GI disorders, and any kind of mental illness or psychological problem can come back with stress and transition. But typically, if they've got adequate coping, they'll be able to implement them more quickly each time it comes back.
Does anyone else, we have about 7 minutes left. Does anyone have any questions for Allie or even Mary before we wrap things up?
Alex, I was gonna mention I sent an email, but I sent the resources for diet and nutrition with inflammatory bowel disease from the Crohn's and Colitis Foundation. That is a super great resource that I refer patients to all the time. It's very comprehensive, and if you have like certain specific questions about certain diets or food, it can be a great thing to look through, and it covers a wide range of topics. So that's a great one.
Awesome. We will be sure to share that as well. Lots of great resources coming to you guys. Any last burning questions? All right. Well, thank you guys so much for joining us, and thank you so much to our presenters today. I loved all the questions. We know that everyone was very engaged, and we're excited to connect with you further. Paulette and I will be sending out a recording as well as these resources probably in the next day or two. And we'll be reaching out to give you guys more information about our Take Steps Walk. As Carly mentioned earlier, all of this amazing research that you heard about today is funded because of programs like Take Steps. And it's an awesome way just to build that sense of community and get a little bit of that social interaction virtually, as Allie was mentioning. So we'll be reaching out, and we're excited to get to know each and every one of you a little bit better. Thank you.
Thanks.
Thank you.
Buddy.
Thank you.